UK Healthcare Community Connection is sponsored by UK Healthcare.
You heard the announcer. It's time for another UK Healthcare Community Connection as we are joined by Dr. Lindsey Jasinski and Dr. Marc Woods from Eastern State Hospital. Welcome.
Nice to see you. Yeah,
yes,
good morning.
Good to see you guys. So we're here to talk about a first-of-its-kind program. It's called EmPATH. What exactly is that?
So EmPATH stands for Emergency Psychiatric Assessment for Treatment and Healing Unit. It's brand new, started in July of last year, and it's meant to be an alternative to the ED for behavioral health crisis. And in this case, our patients are the ones that define the crisis. So it could range from anything from anxiety, severe depression, suicidal thoughts, substance use disorders, things like that. Things where traditionally people would go to the ED for. Instead, we want people to come to the EmPATH Center where they'll be greeted by behavioral health experts immediately, assessed, and we'll begin treatment. So it's like a 23-hour sort of stay with us, and then we make decisions with the patient about where to go after that.
Lindsey, why is this so vital to our community?
So traditionally, our emergency departments have been the place for behavioral health crisis, and we know that's not a calming therapeutic setting for someone who needs behavioral health support. And so this gives 24-hour access. It is open every day of the year at any time that someone has a crisis to anyone in the community. They can come up, they can be brought in by an ambulance, they can come to us in any way. So it is easily accessible, very low barrier access to behavioral health care.
So it's available for anyone?
Yes.
Anyone. So what can they expect during this?
Yeah, so when folks come in, they'll see a behavioral health provider within minutes of coming into the facility. We have peer support specialists, social workers. They can expect to get a chair in a wide open setting, and they're able to engage with behavioral health support. That might mean medication, it might mean therapy services, and then continue their care for up to 24 hours. And the vast majority of people do not end up hospitalized. So only 1 in 4 people that come to us need further hospitalization. So most people can expect to go home.
Appointments needed?
No appointments needed. As Lindsey said, you can drive yourself up. In fact, when we first opened up, we had a lot of different people thanking us for being able to kind of go at 1 o'clock in the morning or 3 o'clock in the morning, or even on a holiday where a lot of places are closed or ultra busy, or their services are kind of reduced. But yeah, so they can drive themselves up. A loved one can drive them up. There's no need to call in advance. You just kind of show up at the front door and the process starts.
Well, thank you both for offering this service to the community. I know many people, as you mentioned, greatly appreciate it.
Fantastic, yeah.
Thank you.
Thanks for coming in. Can you see on your screen if you want to learn more information about UK Healthcare? It's right there for you. We appreciate you being here, and we have, 30 more minutes of news.
We do. We'll be right back.
Bye-bye.
You're watching Fox 56 News. Our home, your news.